Gotta love technology, right? You'd give me the little light or the green light or the thumbs up. Okay, we're good. Well, good evening, everybody, and welcome to our first community conversation of the year. In fact, I think it's, given all the craziness of last year, it's the first community conversation of probably going on a couple of years. So again, we started these a few years ago just to provide regular periodic updates regarding matters and current issues of concern in our community, in our district. It's designed to be very concise, succinct, and to provide information and to provide an opportunity to get questions from our community about these same issues. So we always, the norms are we go for an hour. I try and provide some points and some general information, and then there's a process by which we get feedback. If you're here with us in the in-person audience, there's little cards that I believe Mr. Downs was passing out that you can write your questions on. And likewise, you can fill them out online, and we will sort them and attempt to cover as many of them as we can before the end of our time together. So again, thanks for taking time, either in person or online, for joining us. This evening's topic of conversation is focused on a couple of important issues. One is the federal American Recovery Plan ESSER grant, or Elementary and Secondary School Emergency Relief Funds. This is the third wave of the federal money for many things, one of which is for schools. And we've been on a pretty thorough, comprehensive process in terms of planning, focusing, and preparing to submit our grant to the state, which manages the grant. So we'll give an update on that. I also would like to give everyone an update on where we are with the ever-changing Path Forward plan, which again is our return to safe learning plan. So we'll go ahead and get started. Again, the long multi-word law that I mentioned is affectionately known as ESSER because it is kind of a long word. So I just wanted to just provide a quick summary of where we're at. The ESSER grant has defined parameters or specific objectives that the money can be used for. It is funded based on a formula that's largely weighted based on poverty indices and free and reduced lunch program participation and things like that. And we received approximately $3.4 million in our district. And the focus is defined, and you see the bullet points there. Continuity of services, which is basically preserving programs, maintaining staffing, protecting programs like the fine arts, athletics, academic programs, maintaining class sizes. Academic supports is more like targeted services, individualized help, tutorial programs, after-school programs, summer programs, things like that. Of course, there's been a lot of attention on the area of mental health and wellness, and that's another area where districts are allowed to target these resources. And then health and safety, which for these purposes generally refers to mitigation, cleaning, sanitation, health, hygiene, the things that have been right at the forefront of our mind, especially over the course of the last year. So those are the activities. We've been on a mission, on a process. We do have a core committee that has been working on evaluating priorities, formulating some conceptual objectives, and organizing some of the things you see on the slide there, which includes a survey, which I'll summarize briefly here in a bit, but also providing some focus groups for different stakeholders so that we can get input about which of these allowable areas seem to be important and in greatest need here in our community. So we've talked to faculty groups, staff groups, business leaders. We had a large public focus group within the last couple weeks, and tonight we're just going to provide, again, a little bit of an update. So there was a survey. It's called the ARP. Again, ARP is American Recovery Plan. ARP ESSER 3 Community Survey. We got about 1,000 responses. The largest subgroup was our parents, where we had over 600 responses, but we also had students and staff and other members of the community. The results were intriguing in that they really didn't show a significant amount of variance. That looks like a Likert type of a scale where you prioritize and rank order the relative importance of different areas. And you can see that although there is a slope, that it looks like they're listed from the ones that got the greatest emphasis to the ones that got less so, but you don't see great variance there. They're all, they all seem like they were deemed significant and important. Some of the major themes include student learning, and this also came out not just in the survey, but in these focus groups with these different stakeholders. We heard about the importance of student learning, and that looks both like additional tutoring, additional summer school, but also opportunities for more individualized help during the day and more targeted assistance to help meet individualized needs as a result of the journey that we've been on to help students maintain a solid trajectory. But there was also a theme that really resonated a lot with folks, which is the fact that our students have been through a lot, our world's been through a lot, and that the importance of providing access to and support in the area of mental health and well-being, and making that convenient and accessible so that we're providing education, general type of knowledge and information, but also small group for specific needs, and also crisis intervention when that's needed as well. So that's kind of the ESSER 3 survey. And again, that's kind of where we're at. Where we're at right now is we're at the point, our core team, of taking all this information and a lot of the themes that I think you heard here, including the importance of extended instruction, giving students more time, more individualized support, more opportunities to master academic objectives and enrich the learning that they've had to further solidify the learning. But again, also a focus on supporting things that we've always held near and dear in this community, full-time counselors at all of our schools, a comprehensive guidance curriculum, advising, and partnerships in the community with mental health care providers to make sure that we have a network to easily connect our students to meet their needs. So the grant is in the process of being submitted. We will post our expenditures and the targets and the objectives on our website so that folks know exactly where these dollars are going to, and definitively that they will be going towards these identified goals that we've mentioned. So now let's talk about the path forward. This plan was formally approved by the SUSD Governing Board on July 14th, so fairly recently, and it's part of our, not only is it required, but it's part of our comprehensive efforts to consistently look at the situation, the journey that we've been on. We know that it has changed, and for better or worse, it continues to change rapidly even as we speak. And also to make sure that our actions are aligned with best practices and with our relentless efforts to keep our students safe and also learning in the most ideal environment possible. Tonight, again, the plan in all of its detail is posted on our website. Tonight, I'm going to focus on a few specific issues that have been getting a lot of attention. And so reasonably, you would expect that in the community and certainly with our families, they're on people's minds. And so we want to provide as much clarity and certainly try and answer any questions that there might be. So one of them is masks. So I would say it's masks, testing, vaccination, and quarantine. Masks, as we know, has been the topic of tremendous conversation all over the country and certainly in our own local community. It's interesting, and I put on the slide just a few notes just to show how divergent the information is and how it changes and how different points of view are out there. So you remember in May, our Federal Health Care Agency, the Center for Disease Control, published in a nutshell, and I'm paraphrasing, but I think it's pretty accurate. Masks generally are not needed if you're fully vaccinated, with very few exceptions. Masks should be worn if you're unvaccinated. That's basically a summary of what I recall that they said in May. And you know, a lot of things have changed since then. We know that the Delta variant has taken hold. We've heard about how the numbers of vaccination rates haven't been as robust as would have been desired, which has provided an opening for these variants to take hold, et cetera. So yesterday, the same agency, the CDC, made a statement that it was longer than this, but basically it said that masks are now being recommended to be worn in schools. The American Association of Pediatrics, that's what AAP stands for, likewise recommended that every child over 2 years old should be wearing a mask in school. On the other hand, our own state, the state of Arizona, as part of the legislative session, passed a law that had a regulation in it that said that there cannot be mandatory mask mandates in Arizona, period. And so you can see where it puts schools and perhaps other entities and families in kind of an awkward position. I really believe that in my heart of hearts that even despite differences of opinion, thoughts, perspectives, that we all want to do the right thing. We want our schools to be open. Ideally, we want them to be open fully. And yet we want everybody to be safe. So this kind of murkiness kind of creates a challenge for all of us, and it creates additional, I think, stress, and because uncertainty kind of does that to us. So I want to just tell you where we're at right now is, again, the board, not only has the state said that mask mandates are not allowed, they're actually against the law at this point in time. Our board has approved mask optional. That's where we're at right now, so masks are optional. They are recommended. We recommend them, especially for those who are unvaccinated. We have a population of our students that by their age, they're not able to get vaccinated, which is basically all of our students at least through grades K-5, and I would say even somewhat into the 6th grade. So, you know, they are recommended. The variant is concerning from what I think we've all heard. I don't think anybody would argue that this variant is proven to be more contagious and more virulent. It packs a stronger punch. So that's the deal with masks. So at the same time, we are respecting the choices that everybody makes. I think there's lessons here about teaching our children to be respectful of what others do and what others don't do. And so I'm hopeful that with our shared efforts and with other mitigation steps that we can continue down this path. As far as any other legislation, regulation, direction, I think we'll need to stay tuned for that because as we know, these things change very rapidly, but masks are optional. We do anticipate continuing fidelity of our mitigation strategies. So the things we learned that we believe contributed to the relatively low, I would say really low based on what we know, transmission rates in schools, we're going to keep doing them. And we were already going to keep doing them, and now frankly with this additional concern about the new variants and especially given the fact that a large number of the people we serve, the children, are not vaccinated, we're going to continue as much as we can with a lot of these practices. So distancing practices, spread them out as far as we can. That doesn't mean we're not going to have cooperative learning groups. If there's redeeming educational value, we will do that. But we're just not going to ignore the value of being distance conscious. Same thing with cohorting. As much as can be feasibly separated, whether it's in the cafeteria or on the playground, we're going to promote and reinforce those norms to the extent that it's feasible. It's not as feasible when you have everybody back, and we know that. We're going to do the best that we can. Movement procedures, we've all seen, these are routines that we've now become accustomed to, how we move around, how we go down, how we navigate down the halls. Health and hygiene, you know, we've learned habits that hopefully are beyond COVID. They're just good habits for being healthy. You know, washing your hands, being conscientious of, you know, putting your fingers in your eyes and nose and things like that. So we're going to continue those practices. Also, cleaning and sanitation are with very few modifications. The cleaning, the frequency, the sanitation, the playground equipment, the use of PPE, all those things are going to continue. The focus on airflow and making sure that we have regulated percentages of fresh air, those kind of things will continue. The availability of PPE. So we're hopeful that those will also be mitigation strategies that will help advance these goals. The next piece is vaccinations. We know that, and there's lots of, again, thoughts about vaccinations. I think that the best health guidance we have is that there is a correlation. Of course, it's there's many variables, it's hard to imply causation, but there's a correlation. As more people have gotten vaccinated, the cases have gone down. So the evidence suggests that these vaccinations are very efficacious. And so they will be optional. Nobody's going to be required to have the so-called vaccine passport or anything like that, which was also in the governor's law that we can't do anyway. But we're not going in that direction at all. Again, we want to be respectful of the choices that people make. We will continue, as we've done, to collaborate with public health agencies if they want to provide convenient access through appropriate procedures to the vaccines. We'll continue to collaborate, cooperate, and support those efforts. Testing, again, the operative word is optional. With the growth and the rates of this new variant and the number of cases, the best advice we've gotten is that testing is still a viable tool. We don't anticipate that this is going to be mandatory. I believe this also, mandatory testing for learning, was also in the governor's, in the bill that the governor signed. So we're not going to do that anyway. I do anticipate that we will have optional testing. And at this point in time, although athletics is considered extracurricular, we anticipate that that will be optional at this time as well. And now, case follow-up. So just a couple of points just to clarify. Case follow-up, in other words, when somebody is identified as being positive for COVID-19, or frankly, there are other pathogens that fall under this level of regulation and control, measles, whooping cough. But this is required. When somebody is identified as positive, there is a requirement to follow up with these cases and do things like check for close contacts and things like that. Of course, there's rules that the public health experts have on how that should be done, and we follow that guidance. So really, when we talk about tracing and isolating and quarantine, really we're under the county's authority, which compels us to enforce these types of measures. And we've worked to appropriately and with fidelity follow these and implement them. We'll continue to work with them in this regard. In regards to quarantine, I know that there's been some questions recently. Like I said, a lot of things are changing in many different directions. And so the advice of the health authorities has been, continues to be, that if somebody is identified as a close contact, which is within a certain radius of somebody who's identified as positive, then unfortunately they have to go home and quarantine until and unless certain criteria is met, a certain number of days, et cetera. And the same public health authorities have said that if somebody is vaccinated, that they don't have to do that unless they show symptoms, and then they have to go get tested and quarantine and isolate. And so this has been the source of some, I guess you'd call it debate. The governor's staff recently sent a letter to a couple of districts. One of them is in Pima County, the Catalina Foothills School District. The other one's in Maricopa County, I think is Peoria. And basically suggested that that vaccines can't be used to discriminate. And so the way that we're approaching it, again, in line with this is not new, this is how schools have operated in regards to public health as long as I've been in education, which is a really long time. And what they've said is that if somebody is a close contact, they have to isolate. If they're vaccinated, then they don't unless they show symptoms. So those are the procedures that we will be following until and unless some legal guidance has emerged. Because at this point, again, this is not new. If you think back a couple years ago, there were a couple cases of the whooping cough. I think it was actually in the Vail School District. And again, whooping cough is one of these diseases that falls under this regulated category. And so anybody that was unvaccinated for whooping cough in Vail had to go home. Similarly, a couple years ago in Disneyland, of all places. There was a measles outbreak, a couple cases of measles. One of them may have had a link to Arizona, but we were looking, again, at folks, if they're not vaccinated and there's an outbreak, the rules are that you have to go home. So we believe that this is not about this. We welcome every student to come. You're vaccinated, you're not vaccinated, we want you in school. But from a public health standpoint, if a public health outbreak or situation is present where we're compelled to quarantine individuals based on public health criteria, we will do that. And we're doing that in accordance with this criteria. You know, we wouldn't want to make people that otherwise shouldn't have to quarantine go home. And similarly, we wouldn't want people whose situation just factually creates a significant public health risk for others. And so we feel that this guidance is sound, it's in line with the law, and we've consulted also with our attorneys. I believe the Catalina Foothills District also submitted a response. And so at this point, again, unless legally there's an additional change, this will be the practice that we anticipate implementing in regards to quarantine. So I just wanted to be clear about that so that there was no question or uncertainty. And again, if something changes, we'll keep everybody posted, absolutely and for sure. And I guess in the end, before I try and answer a few of these questions, I just wanted to say that one of my goals for this year is that we can focus on finding common ground. You know, think about last year at this time. Last year at this time, we knew that the first day of school was going to be empty. Empty schools, empty classrooms, empty ball fields, empty marching band venues, empty auditoriums. And for me, that was really sad to walk around and almost could hear a pin drop. So I'm excited to be back. I'm excited that on Monday, good Lord willing, we're going to welcome schools full of young people that are excited to be back, staff that's ready to welcome them, and a year that's hopefully going to be, as I call it, an ordinary, extraordinary year, not an extraordinary year like we had last year. I think we have a lot to be grateful for, really excited, new programs. We have largely expanded dual enrollment programs. We have a brand new career and technical program in health professions in partnership with the hospital across the street. We have 32 brand new teachers to our district that I think are going to bring a lot of enthusiasm, ideas, and energy. So, and we're growing. The preliminary indication is that a lot of the folks who, for whatever personal reasons, made choices for their families that they thought were best are coming back. And we welcome and want everybody back in our school community. Again, my hope is that we're going to focus on common ground. We all want the same thing for these kids. We want to be safe, we want to be well, we want to be in school, and we want schools open and fully in person. And by all of us doing our little part at home with our own families, checking them, making sure that if there's a question, if they're sick, they stay home, we communicate, and that we follow these rules and listen to each other and try and find that common ground. I think it's going to be a great year, and I'm looking forward to it. So with that, I would be glad to take the questions that are forthcoming and do my best to try and answer them. And if they get really hard, I have my colleagues here that can help me out. So Amber, do you have my? Mr. Downs, you want to go get do we have any cards over there? Yes. Looks like we do have a couple questions. So we'll bring them up. Thank you. Thank you, Mr. Downs. knew there was a reason I brought the reader glasses. All right. Okay. This one talks about a concern about a variant if there's no test to confirm. Again, and first of all, I'll be the first one to put any disclaimers that my formal education is an education. My doctorate's an education. I don't claim to be a medical expert, but in terms of the information that we've gathered and the consultation which we do feverishly in search of just trying to do the right thing, in terms of the variant, the feedback that suggests the concern is the rising numbers. I saw a data set today from the Pima County School Superintendent, Dustin Williams. He sends us these because they have access at their fingertips to all the county's data. And without remembering specific numbers, there is evidence that the cases at the elementary age have gone up. Now, they're not soaring, but compared to how non-existent they were, there are some cases that are becoming present. And similarly, a lot of this thing, and to me, I'm just speaking my heart and my mind, some of this, I think, is just the uncertainty. I kind of ask myself, okay, so why are they asking everybody to wear masks again, given that even if you're vaccinated? And for example, what I heard about that is that what they're finding is that even people who are vaccinated, if they're exposed, they might not get sick, but that there's question that they have the same load as somebody who actually gets sick in their nasal passages, and they could spread it. So part of it, honestly, I think is uncertainty and playing it safe. You got another one for me there, Mr. Downs? Okay, thank you. County authorities need to follow certain steps to be able to quarantine. Can you explain what steps they will be taking to quarantine someone? Thank you for that question as well. Actually, again, at the county, they probably see my number, and they probably run, because I ask them questions. And I spoke to them today about this type of issue, because I know it's been a question, and I do anticipate that they will be having more specific feedback about the steps. Again, we are basically the pass-throughs, the agents who act on their behalf to do these types of quarantines. Again, we are trained on the basic steps. The basic steps are pretty basic, but we do it under their authority. And I do expect that additional feedback from them will be coming. Will entire classes be quarantined or just the individual? As far as the process, honestly, as far as the quarantine process, the only thing that I understand has changed since last year is this counsel that if you're fully vaccinated, these vaccines are deemed to be efficacious enough that it's reasonable to not have to quarantine, that precaution is not needed unless you show symptoms, because the odds, the number of breakthrough cases are so low. How will it be known who is vaccinated to quarantine or not? That's a good question. So because the standard is you have to quarantine if you are a close contact, what's anticipated is that in order to not have to quarantine, it's reasonable to ask people to provide proof that they've been vaccinated. And if they don't want to show the proof, they can quarantine, because that is the standard position. I think if we're going to do that, we have to, because if we think it's important enough to quarantine people who are not vaccinated, and we're going to provide somebody with an alternate path, it's not unreasonable to say conditionally that we have proof that vaccination has taken place. Let's see. What is considered close contact? How many feet? Okay, so close contact is defined as being within 6 feet of another individual for 15 minutes or more in a 24-hour period. I didn't make that up. That's the actual definition of close contact. If students get sent home to quarantine, how much impact will this have on their education? Is there a process for teachers to follow? Well, and again, my colleague, Assistant Superintendent Bonner, is here in the audience. One of the things we've worked is to refine and develop strong norms and practices and expectations and professional development for how we do remote learning. One of the things that we're very clear on and that we're continuing to push relentlessly is fidelity of instruction. If somebody's quarantined, they are coded as COVID, CV. It's an excused absence. And so we send them home and we expect that as long as they're healthy, that they're able to keep learning and that we have standards for making contact with those students, providing direct instruction, holding students academically accountable, and really allowing them to continue to succeed. Because that was, honestly, as we were building the plane, as we were flying it last year, that was a challenge, is creating those standards of fidelity and instruction. And I think, if I can speak for my colleague, Mr. Bonner, he's very much about total quality and consistency of expectations. So I think that students who are in that situation will see clear expectations and norms of instruction. Will ESSER 3 be used for tech and after school, for tutoring and after school? I would say that the data suggests absolutely. In fact, by the law, again, I didn't go too much into the weeds, it is online, 20% of that allocation must be used for that. And Mr. Bonner's already working on that. And I would anticipate that what kids need, these kids have survived a pandemic, God bless them. And our job is the way we can help them is to give them the gift of time, the gift of more individualized support so that they can continue to accelerate. It's not about remediating and going backwards. It's about continuing to go forward, but with the supports to consider what they've been through. AIA, new guidelines. What does this mean for our athletes? Again, I actually read the new AIA guidelines. Like I said, I read everything I can get my hands on. And basically, I'm going to summarize it. The way I heard it is that, well, I shouldn't say that. I should speak for myself. The way I inferred the AIA guidelines is that the norms that have come out from the state, pretty much what I just described will be our norms coming out of the gate next Monday. Those are kind of in line with the AIA's guidelines. And if we are our sports programs have to be in compliant with that. So there's still mitigation and there's still safety protocol that has to be followed, but we have that too. But as long as those are followed, and unless something changes, sports programs can continue to operate as they've been operating in a semi-normal manner. So here's how I liken it. Just like I expect school will look fairly normal. There will be kids in classrooms and they'll all be there at the same time, but there will be some changes, there will be arrows and there will be more cleaning, and you'll probably have a significant number of students wearing their masks, those kind of things. So it'll be fairly much like normal. And I think that as long as things stay the way they are, that's kind of my understanding of where we're at with sports. Given the pre and current COVID trend of academic decline, including SUSD, absolutely. What evidence-based strategies and methods are being employed to help our students reverse the decline and reach higher standards? Thank you for that question. Sometimes in the midst of talking about masks and hand sanitizer, we just have to stay focused on the fact that we're about teaching and learning. And so our approach to this effort, and I kind of alluded to it a little bit, is personally, I think we need to shift our mindset away from this idea. I hear the word gap, and I know what we mean, but I don't liken it to a bucket that we just need to backfill. I liken it to our students have been through a lot. We need to do what teachers do, which is evaluate programs, identify through assessment data, placement data, formative assessments, where our students are strong. A lot, and if you look at the AZ Merit, and if you'd like to, Mr. Bonner is going to be making a presentation here within the next month or so, where he's going to talk about our data. We did better than the state average, but we did have declines in some areas more than others. I think math is probably one that stands out where we took a hit, and so did everybody else. But I think our approach, instead of looking backwards, is saying, what are the individual standards that need more attention? What are the individual, the needs of individual students? And kind of providing a spiraled approach through after-school programs, through summer programs, through in the school day programs like reteaching and enrich, manage your progress, power hour, they call different names. But really looking at where kids are, what their strengths, refinements are, and addressing them systematically as we go forward. We don't want to go back. We want to go forward, but acknowledging that there are some areas that are going to need to be taught, retaught, spiraled, and reinforced. Will SIS and SPS go back to combined bus rides, or will they still be separated? Answer, separate. I think I know what this means. And again, I don't have the schedule in front of me, but we fortunately, I think, although not by design, we planned to change our bus routes from 2 tiers to 3. And so the 3-tier allows for greater separation. So the SPS routes are the SPS routes. As far as whether they take the SIS kids on them, I'm looking at my colleague, Mrs. Huey. So 2 of them. So the SIS and SPS kids ride together. They will not ride together, they ride separate. So that is the answer to that one. They will ride separate. Let's see. Did I have more that I missed? Amber, I didn't want to miss anybody. Okay, thank you. Will unvaccinated athletes be masked? Again, I don't have the AIA guidance right before me, but again, in line with the themes that I hope you've heard this evening. The masks are optional. We're going to put in all kinds of mitigations. Masks may be used, but at this point, just like unvaccinated students are not going to be forced to be masked, unvaccinated athletes, I don't foresee, are going to be forced to be masked. There will be parallels. I anticipate that those will be parallels. I don't think the AIA guidance contradicts that. Again, my general rule of thumb with all sports is that the general rules that we have in place for the school operations apply for the AIA, and all of the provisions and conditions too. If somebody tests positive, if somebody has close contacts, whether they're masked or unmasked, the same rules will apply. So hopefully I answered that. Let's see, Amber, do you have any more for me? Well, with that, again, I'd like to thank everybody for coming physically to our community conversation. Again, we anticipate that that'll be another renewal thing this year, is that with regularity we will have these updates operated just like this, and both in person, and also like to thank the folks that joined us online. Bottom line is, I am truly excited to be back, to have our students and staff back, and to have, as I said, an ordinary, extraordinary year. And I know that together